Good day everyone. Today we will be presenting our best analysis on the impact of COVID-19 on the healthcare sector. My name is Yogeshwaran and I will be begin with the introduction. The healthcare industry is one of the most important sector in every country because it is responsible for protecting people's health and providing medical care. It includes hospitals, clinic, healthcare professionals and many more healthcare related services. During the COVID-19 pandemic, the industry faced many challenges, including a rapid increases in patient numbers, shortages of medical resources, and tremendous pressure on healthcare workers. Despite these difficulties, the healthcare sector adapted by introducing innovations such as telemedicine and online healthcare services to ensure patients continue receiving quality care. In this presentation, we will analyze the impact of COVID-19 on the healthcare industry using pest analysis framework. Through this analysis, we hope to provide a better understanding of the challenges faced by healthcare sector and the opportunities that emerged from the global crisis. Without further ado, I would like to move to the next part. Thank you.
The healthcare industries is considered one of the most crucial industries in Malaysia. It is one of the most well developed industries that has crossed over a market size of 27.87 billion US dollars and is continuing to grow at an average growth rate of from 6% to 9.1% according to the stars. So the major players of the healthcare industries includes IHH Healthcare Berhad and Top Glove Corporation Berhad. So this industry is very crucial as it is the very backbone of the necessities that is provided in Malaysia. How does the pandemic affect the healthcare industry in Malaysia? The first one would be the drastic implementation where services were restricted to urgent needs, where overwhelming number of patients admitted leading to a capacity strain in hospitals, resources allocated to build quarantine zones as well as treatment centers to accommodate the large numbers of patients who are infected. And lastly, would be the first initial stage where there is a lack of equipment that is necessary to protect themselves as well as to treat patients were lacking. This an example would be testing kits as well as the PPEs required.
Hi dear lecturer, my name is Bhadrani Mukandas. Today I am going to present about the pest analysis of the COVID-19 pandemic. A pest analysis examines that the impact of an external environment through to the four key factors, which is political, economic, technology and also the social. Okay, first let's look at the political factors. During the pandemic, governments around the world introduced various of measures to control the spread of virus. These include lockdown, movement restriction, quarantine requirement, and also social distancing rules. Government also provided financial assistance and stimulus package to support the business and individual affected by this crisis. In addition, vaccination programs and also the strong health policy were implemented to protect the public health and also support the economic recovery. Next, at the economic factor, COVID-19 caused major economic disruption globally. Many businesses had to reduce their operation, close temporarily, and also even shut down permanently due to the declining demand and financial difficulties. Unemployed rates increased as companies reduced their workforce and also to manage their costs. Global supply chain were affected, resulting in the product shortage and also the delivery delay. However, the pandemic also created an opportunity for industries such as e-commerce, delivery service, digital solution, and also consumer increasing rely on the online platform. So next, moving to the social factors. The pandemic signification change pupil lifestyle and also behavior, health, hygienic, and also. So now, moving on the social factors. The pandemic significantly changed pupil lifestyle and also the behavior. Health and hygienic became the top priority, leading increased demand for the healthcare products and services. Many employees shifted for working from home, and while many students are adapted to the online learning, social interaction became limited due to the movement restriction, which is also affected mental health and overall well-being. At the same time, communities became more supportive and also aware of the helping one another during these challenging times. Finally, let's discuss about the technological factors. COVID-19 accelerate the adoption of the technology across to the many sectors. Businesses invested in digital tools to support the remote work and maintain their operations. Video configurations platform became essential communication, while the online learning system helped to ensure continuing in education. The healthcare sector um, also benefited from innovation such as the telemedicine and also the digital health services. In addition, organizations strengthened the cyber security measure as more activities shifted online. So, in a conclusion, although the COVID-19 pandemic created many challenges, it also encouraged to the innovation, accelerated the digital transformation. These changes introduced during this period continue to the influences of business growth and also social today. And that's all from me. Thank you.
During the COVID-19 pandemic, political factors played an important role in supporting Malaysia's healthcare industry. The government introduced measures such as Movement Control Order and National COVID-19 Immunization Program. These actions helped control the spread of the virus and increase healthcare capacity. Additional funding and coordinating among government agencies strengthened the industry's resilience. However, frequent changes in SOP sometimes created confusion among healthcare providers and the public. The healthcare sector also became highly dependent on government funding and policy decisions, which exposed certain vulnerabilities. Economic factors clear both opportunities and challenges for the healthcare industry. Increased government spending and healthcare investment help improve medical facilities and services. Public private partnerships also allow healthcare providers to manage increasing the number of patients more effectively. However, hospitals face higher operational costs due to PPE, testing kits, and medical equipment. Global supply chain disruption also caused shortage of essential supplies, creating financial pressure on healthcare institutions. Social factors significantly influenced the healthcare industry during the pandemic. Public awareness regarding health, hygiene, and vaccination increased considerably. Because society also shows strong support and appreciation for healthcare workers. These factors help improve public cooperation with health measures. However, healthcare workers experience burnout, stress, and mental health challenges due to heavy workload. Some patients delay seeking medical treatment because of fear of infection, while one vulnerable group face difficulties accessing healthcare services.
Hello, my name is Aina Sofia Suhaisi, and I will be touching on our strengths and weaknesses, but for our technological factors. For our strength, we have three, just the same as others. One is the growth of telemedicine and MySejahtera implementation. Second, being our digital healthcare services, and third, being improved healthcare efficiency. Why are all of these our strength? It's because with the growth of telemedicine and MySejahtera implementation, there are more access to booking and reserving slots or appointments regarding your sickness easier through the MySejahtera app. Even though the COVID-19 we hated MySejahtera actually helps now with booking or reserving an appointment at a public hospital that we have. Secondly, our digital healthcare services. There's also the same as our MySejahtera, but our digital healthcare services would be having not MCs, but diagnosis before going to your appointment itself. And thirdly, we have to improve healthcare efficiency, which is, now healthcare is way more accessible for everyone and anyone in Malaysia. Because of technology. But for our weaknesses, we have digital divide in rural areas and limited digital literacy, cybersecurity concerns, and healthcare access inequalities. Let's start with the digital divide in rural areas. As I said, now healthcare is accessible to everyone and anyone. But with technology, there's also concerns on older generations or even people that don't have technology at their house or accessible technology for them. Example, people in poverty don't really have the device that they could check my Sujatra, or even just people with lower specs of phone might not access people with higher specs of phone because they require updates and etc. Cybersecurity concerns. With having technology implemented in healthcare, any technology requires online database, and with that, it also has the concern of cybersecurity, which is hacking, um, a lot of threats coming from outsiders, which could really impact the healthcare system, especially using technology. And lastly, healthcare access inequalities. This is the same as the digital divide, but this is more towards the whole hierarchy of people. So if you were to be a bit more on the poverty side, you wouldn't afford to, book some book an appointment there. Or another good example, or I keep saying or, but another good example is with technology. It doesn't only mean the digital app, it also means our facilities. Example, if you were to make an X-ray scan, it will be now, as much as it is our strength now that we have a more better equipment, but with better equipment is higher cost. Therefore, higher cost equipments with technology implemented, healthcare is not as accessible as it used to be because the fees are higher. So that's all the weaknesses.
Okay, good morning. Today I will be present the pest analysis the COVID-19 pandemic. COVID-19 was one of the biggest global challenges in modern history, which affect health, business, education and every life. Although it's a create many difficult, it's also both important lesson and opportunity for improvement. Okay, first of all is political factor. From the political, government introduced the lockdown, travel restriction, quarantine measure, and vaccination program to control the spread of the virus. The action helped protect public health and reduce infection. However, the frequency changes in regular sometimes create a confuse for the both of the public and business. The second one is economy factor. From an economy perspective, COVID-19 caused major disruption worldwide. Many businesses were forced to close temporarily while some shut down permanently due to financial difficulty. Industries such as tourism, hospitality, and aviation were heavily affected. At the same time, healthcare, e-commerce, and delivery service expenses. The government also provide the financial assistance to support business and individuality. Third one is social factor. Socially, the pandemic changed the way people live and interact. Health and hygiene become more important while working from home and online learning become a common. However, many people experience stress, loneliness, and mental health challenges during the isolation and uncertainty. The pandemic also highlighted in the access to healthcare, education, and technology. The fourth is technology factor. In terms of technology, COVID-19 accelerated digital transformation across many industries. Online learning, telemedicine, visual meeting, digital payment, and online shopping become a part of daily life. The advantage improve the convenience and efficiency, but they also raise concern about cybersecurity and data privacy.
In conclusion, the COVID-19 pandemic had a major impact on the Malaysian healthcare industry and changed the way healthcare services were delivered. During the pandemic, the industry faced many challenges such as the rapid increase in the patient numbers, limited medical resources, rising operational costs, and heavy pressure on healthcare workers. Despite these difficulties, the healthcare sector remained resilient and continued to provide the essential medical service to the public. Based on the past analysis, political factors such as the government support, healthcare policies funding, and the vaccination program play an important role in strengthening an industry response to the crisis. From an economic perspective, the pandemic created both of the opportunities and challenges. While the increases demand for the healthcare services contribute to the industry growth, healthcare providers also face a higher operational and the treatment costs. Socially, the pandemic increased public awareness about the health hygiene and the disease prevention. However, it also the highlight issues such as healthcare workers, burnout, and the unequal access to the healthcare services in certain communities. In terms of technology, advancements such as the telemedicine, digital system, and the mice Jatra application help ensure that healthcare services remain accessible during the movement restriction and lockdowns. Overall, the pandemic accelerated the transformation of the Malaysia healthcare industry and demonstrate the importance of preparedness and innovation and adaptability. Moving forward, the continued investment in the healthcare infrastructure, technology, workforce development, and public health initiative will be essential to build a stronger, more efficient, and sustainable healthcare system in the future. Thank you for your attention.